We're joined today by Dr. Mullen. She's the Commissioner for the State Department of Health for Connecticut. How you doing today?
I'm doing well, and I'm happy to be here. Thank you.
Oh, we're happy to have you.
Thank you.
So, I mean, we're talking about, you're in New Orleans.
Yes.
The one of the worst disasters ever in this United States.
Mm-hmm.
Tell me, how do you think it's so important, and why do you think it's so important to be prepared for disasters?
A lot of people go through their day-to-day without realizing how much one thing can change everything in their world. And that one thing can be something big or small. And what I usually tell people is you can't plan for a disaster after the fact. You have to be ready all the time. Mm-hmm. At the same time that government has a big responsibility for protecting people, people also need to think about what they need to do for themselves and their families to be prepared.
Sure,
yeah.
I agree with that.
Mm-hmm.
Now, you were part of APHA's Google Hangout on preparedness in September. Tell me more about that, and what did that accomplish?
The Google Hangout was perfect. Well, it happened during Preparedness Month, mm-hmm. and for Connecticut, that meant a lot for us because while we never experienced an event like Katrina, mm-hmm. we've had a number of natural disasters, and we had the tragedy at Newtown, Sandy Hook, mm-hmm. which is a different kind of disaster. Mm-hmm. And Get Ready happened at the time that the nation was actually mounting a lot of fear around enterovirus D68. Mm-hmm. So there was a lot to talk about. For us, because we've spent so much time telling people, learn to live prepared, it became our tagline. Get Ready gave us a chance to reinforce that on a national level. Sure. It puts preparedness in the hands of people.
Right. Well, how do you think states can respond very quickly to these types of disasters? Because so many things are going, being decentralized from federal just to state.
Right. Well, one of the first things states have to do in that decentralized process is work very closely with their local mm-hmm. governments. Mm-hmm. Both on the public health side and with emergency management. Mm-hmm. We all have a responsibility, and we have to think about preparedness for all hazards. Therefore, communication, surveillance, pay attention to the cues, and then adjust what you need to prepare for depending on the season and the likelihood of certain disasters.
Now that's at the local level. Let's bring it down one more notch to the grassroots level. What can a citizen do to be prepared for these types of disasters? What are your recommendations?
The first thing that people have to do is remember that they're part of the group at risk. Sometimes people say, it won't happen to me. It might happen to my neighbor or over there, but it won't happen to me. Communicate with your family. Have an evacuation plan if you need to evacuate. Know that you have access to your medications. Know that people know how to get in touch with you. Trust credible sources for information.
Very important.
Because sometimes you get the information that isn't really guiding you the right way.
Well, great. You heard it here first, how to save yourself from a disaster. Thank you so much for being here.
Thank you very much.